Hi, my name is Ike Ahmed. I'm from the University of Toronto in Toronto, Canada. I'm a glaucoma and cataract surgeon. My practice is focused primarily on surgical management of glaucoma. Well, I think the uveal scleral outflow pathway has been a very prominent and potent IP lowering mechanism, of course, with our drugs, and this is the first MIGS device that accesses the supraciliary space. The advantage, of course, in this space is the large resorptive area, which has potential for lowering of IOP at very low levels and very stable levels. I think this is an ability now to access that compartment with a more controlled procedure using a microstent. And by doing this, of course, we hope to control flow in a steady form into the suprachoroidal space to provide pressures that I think are lower for our patients and our targets. The Cypass procedure is a very intuitive procedure. It involves visualization into the angle using a gonio prism, as well as tilting the patient's head and a microscope to enable adequate visualization. The procedure involves using a blunt guide wire to basically place it just below the scleral spur, essentially disinserting the ciliary body to place the device into the supraciliary space. Once the device is released, it resides very stable into the supraciliary space to allow for aqueous to pass from the anterior chamber into the supraciliary space. We're very proud to publish the Cypass results, the largest glaucoma trial that's been done with 2-year follow-up, a very robust trial comparing Cypass with phaco versus phaco alone. I think the real top-line results show the safety results being very similar to phaco alone. Side effects or adverse events were typically transient. For example, hypotony was in a small number of patients, transient, self-limiting, and did not affect vision. Other adverse events were very similar to phaco alone. I think, again, providing a testament to this procedure accessing the supraciliary space. The robust clinical design allowed us to show a significant difference in patients reaching target pressures and being off medications, which were greater in the phaco Cypass group than the phaco alone group. I think, again, it shows the additional effect of phaco, additional effect of Cypass on phaco alone in terms of lowering IOP. I think the overall results show, I think, a very good balance between benefit, risk, and effort, and again, approaching MIGS in the cataract population. The Cypass insertion technique is a very similar technique to any MIGS angle procedure. The setup involves rotating the microscope about 35 to 40 degrees. The Cypass device is loaded onto the injector, which involves a guide wire that's gently curved to follow the natural curvature of the undersurface of the sclera. Once the device is placed onto the guide wire is placed in through a clear corneal incision into the anterior chamber, and using a gonio prism approach, the implantation is performed into the angle. Let's look at a case where we show the implantation of the Cypass. So here we have the Cypass that's been loaded onto the guide wire. We're using a TVG lens, a gonio prism here to visualize the angle. We see the trabecular meshwork, which is pigmented. We basically look at the scleral spur and place the guide wire, the very gentle guide wire, just under the spur here, disinserting the ciliary body iris insertion. The curved guide wire allows it to follow the undersurface of the sclera, delivering the implant. Now we basically see 3 rings. We like to place the device at about the second level of the ring, and then basically watch as the cuff is released here from the guide wire, pressing the button, and now we have the stent in position. We typically like to see at least a couple of rings visible into the angle to ensure that we have adequate placement. And you see we've also positioned the device away from any angle vessels to reduce the risk of any kind of bleeding. It's well seated, and the procedure again is performed very intuitively and very efficiently. We've reviewed the merits of the Cypass procedure combined with phacoemulsification, and we've reviewed a case example showing a video of the Cypass procedure combined with cataract surgery. A recently published study, I think, shows the excellent IOP lowering profile of the procedure with a very high safety profile and low serious adverse event profile of the procedure itself. I think the Cypass fits very well in the mixed spectrum that can be offered to patients who have glaucoma going to cataract surgery. I think it's a very exciting new armamentarium for MIGS surgeons in the world and the United States, and we look forward to more and more experience as the procedure becomes more and more available. Thank you.